Hello, and welcome to What to Expect After Breast Cancer Treatment Ends. I'm your host for this presentation, Karen Del Maestro, health coach, breast cancer, and BRCA2 thriver. Let's dive right in. Today, I'm going to share with you the reality of life after treatment has ended. It may be a bit different than you expected, right? I'm going to be showing you exactly what you can do to start reducing your risk of getting sick again, so that you do not have to live with that constant black cloud and looking over your shoulder and waiting for that other shoe to drop. Today, we're going to cover how long before you can expect to feel like you again. Question you probably asked yourself a couple of times, right? We're going to cover the often overlooked side effects from going through breast cancer that are rarely talked about, but you're most likely experiencing. And we're going to cover 4 ways that you can help regulate these side effects while also helping to silence the nagging fear of recurrence. Pretty cool, right? Let's dive in. Plus, I'm also going to share an exciting opportunity to work with me, but it's not for everyone. So make sure you continue to watch right until the end. Now, you're in the right place if you've been surprised and confused about how you've been feeling since treatment ended. You may have even been wondering, what's wrong with me? I know I did. And you're in the right place if you find that the hustle and bustle of life is really affecting you, if you're having a hard time keeping up and you're being hard on yourself because you feel like you should be able to keep up, right? And you feel like you should be able to do what you used to be able to do, but you're just so exhausted all the time. You are in the right place, and I'm so glad that you found us. Now, I felt the exact same way. So here's a little bit about me. My name's Karen, if we haven't yet met. And as I said before, I'm a breast cancer and BRCA2 thriver. I found out that I carried the gene when I got my breast cancer diagnosis. I'm mom to my amazing kids that you can see here, Paige and Jason. And yes, of course, I cried when they wore those t-shirts. It was the day of my double mastectomy, and they surprised me like crazy. I'm wife to my amazing husband, Mike, who is my rock and keeps me going. I'm a self-care expert. Yes, I learned the hard way how to do it and make it part of my daily life. I'm a personal growth junkie, love Brene Brown, love Gabby Bernstein and Louise Hay, and the list just keeps going. Seriously, I'm always looking to learn more about myself. And I'm also a dog lover and lover of the undersea world as a scuba diver. And you can see me and my hubby Mike down in the corner there. Now, I invite you to imagine waking up in the morning with energy, feeling well rested, calm, and ready to tackle your day. Your body feels strong, and you notice a smile on your face as you realize that you're finally feeling well again. Oh, how does that feel? Just to truly sit there and imagine, just for a second, what does it feel like? That, my friend, is where we're heading. But first, we need to practice a lot of self-compassion as we journey through this next stage of recovery, because this is the stage that starts after treatment has ended. Now, 95% of breast cancer survivors imagine that they're going to feel like sunshine and rainbows after treatment's over, right? It's like treatment's done and we feel like we should be like jumping for joy and excited and energy's back and feeling back to normal. The reality, however, is that 95% of breast cancer survivors end up feeling confused, overwhelmed, and dealing with a roller coaster ride of unexpected emotions. I fell into this 95%, and I'm wondering if you do too. This is because after treatment ends is when the true physical, mental, and emotional healing begin. It's rarely talked about. So let's jump in and answer the question I know that you are itching to find out. I don't want to keep you waiting. So how long before you can expect to feel like you again? Well, there's actually a simple formula, but I don't want you to like freak out and think that you need a math degree because you don't. It's super simple. So here's our formula. A equals the date of your diagnosis. That date, probably for most of you, like it is for me, is just branded in my head, right? Stamped on our forehead. We're not going to forget that date. B is the date of your last active treatment. Now, if you're on continuing shots or medications like aromatase inhibitors, hormone blockers, things like that, we don't include that. So the date of your last active treatment, so chemo, radiation, surgery, things like that. And then C, which is the approximate length of time that this next stage of recovery lasts, is the length of time between A and B. Okay, so I want to give you an example, right? These are my dates, my personal dates. So A, the date of my diagnosis, that date that's branded in my head is July 2018. B was the date of my last active treatment, which for me was at the end of my 6 surgeries, was July 2020. Very, very nice and easy mine, right? So the length of time between A and B is 2 years. 2 years before I get to feel like me again. Okay, this helps. And I hope that you've, if not, pause the video and figure yours out here. It's a great time to pause, get your number, because it helps to have your number in your head before we keep going. So if you need to, go back to here, okay, pause it and figure out your numbers, okay? Okay, so moving on, it helps, right? It helps when we know this. I hope you kind of heave a sigh of relief, but you also might be saying, but Karen, that's a really long time. Yeah, it is. Much longer than we anticipated. Certainly much longer than anybody else around us anticipates. Because so often we feel like, okay, we're done with treatment. We've got to get back on with things. And remember early on, I talked about self-compassion. That's where this comes in. So some of the most often overlooked side effects that are rarely talked about, but you're most likely experiencing is what we're going to talk about next. Okay, so these are the things that you're going to be experiencing during this time frame, or that you could be. You may be lucky and not have all of them, but these are so common, and most of the women that I speak with experience these. Now, it's likely that you're already familiar with some of the more obvious side effects from your specific breast cancer treatment, because we all have them, whether it was chemo, radiation, surgeries, or medication. But there's so much more, and it's often not talked about. Now, part of my goal here is to help you know that you're not alone, right? That's why I decided in my practice to start specializing in working with breast cancer survivors at this time. In fact, I'm now known by many as the go-to expert for bouncing back after breast cancer. So you're in the right place. Now, up until now, and you may relate to this, right? You've been running. You've been running to the next test. You've been waiting anxiously for the next result. You've been seeing numerous doctors. You've been through chemo, radiation, surgery, just trying to keep up with life. It's been a marathon, but we're not done. What happened when you hear the words, I'll see you in 3 to 6 months? Now that you can finally catch your breath, everything starts to catch up to you. And I'm going to pop back for a second and share with you my story here. I felt the same way. I was in my plastic surgeon's office and she said, Karen, I'll see you in 3 months. And I was immediately hit with this confusion. Like, oh my gosh, I should be jumping for joy. This is what we've been wanting to hear. And yet I started to sob from my gut, really ugly sobbing. My incredibly supportive husband sitting in the corner. My plastic surgeon holding on to me. I'm hugging her for dear life. And suddenly I'm feeling really alone and scared, confused, because I think I'm supposed to be happy, but that's definitely not what I'm feeling. I don't even know what I'm feeling. I feel like suddenly I've been hit by everything all at once. And that feeling continued for a couple of weeks and these are some of the things that you may be noticing now, that you're exhausted and drained and feeling like you're run down all the time, feel like you're running on fumes, even if you've slept all night. You may be noticing that you've got weight gain, having mood swings, hot flashes, because menopause symptoms are a side effect of most breast cancer treatments. Our hormones are going too lally. They're going crazy. And we're snapping at everybody because we've got no patience. We've got no tolerance for everything. And people around us just are like, they want to give us a space, but they just don't know what to do. They're like, what can I do? And we don't even know what to do. You might have muscle and joint pain all over from head to your toes, coming from the stress, the medication, chemo, inflammation, or even our breast implants. You might be experiencing a lot of anxiety and having trouble sleeping, not having much patience for anything, as I was saying, and our tolerance is just, low to zero, right? Snapping at everybody. We just don't feel like ourselves. You may find that you're suffering with memory lapses and difficulty focusing, talking about brain fog, right? Sometimes, and I know this was something that I struggled with, there was a period where I couldn't even put my words together. I was so scared. I'm like, this is not me. And you just find yourself getting more and more frustrated, putting pressure on yourself, being hard on yourself, wondering why. Is this normal? What am I doing? You may have even noticed that you've got changes in body odor. Yeah, something that we don't rarely talk about. I experienced this too. Not necessarily bad or good, but just different. Your body has gone through major changes. In fact, major trauma. And many of these changes affect our hormones, and that's going to affect our body odor. You might be feeling uncomfortable in your skin, not even recognizing who you are in the mirror anymore. Things like our hair and our breasts are things that have been related to our sense of identity since a very young age. And suddenly they've changed. And we didn't have much control over it, so it can feel really scary. I'm just wondering, who am I now? You may have lost your sex drive, may not even want to be touched. These are all normal. They're so common. And yet we can feel so isolated, right? You're not alone. Please know that. And you may be feeling like you don't want to jump back into your pre-cancer life because maybe it doesn't fit who you are today. You're changed. Cancer changes us. We can't help that. But it doesn't have to be a bad thing. What if life could be better this side of cancer? It can. It can. You just have to choose it. You just have to know that that's what you want. And you may also be experiencing grief. Again, not talked about often. For the body, the life, the relationship, the freedom, the woman that once was. And you most likely feel alone, unheard, and unsupported. And my dear friend, Dr. Christina Hibbett, shared, she's a clinical psychologist, but also a breast cancer survivor. She shared that everyone's there for the physical battle, but the mental and emotional battle after treatment is over, not so much. Maybe you can relate to that. I want you to know that you are not alone. I'm right here beside you as we journey on this path together. And this picture was me after I had my reconstruction removed. There were complications and I had over 25 breast implant illness symptoms, as well as Baker grade 4 capsular contracture. So I decided to remove my implants and go flat. The right decision for me. So next, I want to talk about 4 ways that you can help to regulate these side effects, while you can also help silence that nagging fear of recurrence. So just like, I don't know about you, but like when I got my game plan for treatment, I kind of heaved a sigh of relief. Maybe you felt the same way, where I just said, okay, now I know what's in front of me. I can do this. For me, the hardest part was worrying about, okay, what am I going to need? What am I going to have to do? Am I going to be able to get through it? All of that stuff. Once I knew what my treatment plan was going to be, I felt that sense of relief. And so I want you to feel like that sense of relief now, because I can help you with your game plan for recovery. So this is my overall approach. My overall approach is about reducing inflammation, because inflammation is the root cause of all serious disease. So breast cancer, all other cancers, heart disease, diabetes, obesity, autoimmune, the list goes on. All serious diseases start with inflammation in our bodies. Now, that inflammation can also lead to exhaustion, bloating, muscle and joint pain, headaches, brain fog, mood swings, anxiety, and so much more. So hang on a minute. If inflammation can cause all of those symptoms, would it not make sense that if we reduce inflammation, then that would help regulate the side effects and help reduce our risk of recurrence? You bet it would. You bet it would. So can you imagine walking into your next checkup, scan, or biopsy with the knowledge that you've done what you can to not get this disease again? I invite you to think about what it feels like. If we go back in time, back to when we were in school, what did it feel like when you walked in to take an exam and you'd studied? Like you'd really done the work. You'd done your best, as best you could, to study for that exam. And you walked in and you're like, okay, I've done my best. I know I've done my best. I couldn't have done more than my best. So the rest is out of my control, but I know I've done my best. Versus those exams where you walk in and you're just winging it and you're like, oh, I know I didn't study. I have no idea what the questions are going to be. This is just like completely out of my control. So I invite you to think, what feeling would you like to have when you walk into your next scan, checkup, or biopsy? Yeah, I know which one I'm choosing. So let's talk about these 4 ways to help regulate your side effects and help silence that nagging fear of recurrence. So the way that I do it is we talk about the right foods, right? Because we feel calm and confident when you know how to make the right food choices, but for both you and your family, right? It helps to know that you're giving foods to your family that are also going to help them be healthier. So the second thing that I like to look at is managing stress, because so often stress can lead to that, and I'll dive into it a little bit more, but it can lead to inflammation. So if we had a plan in place for every time we felt stressed or anxious, it would help us to manage it easily, right? With a simple plan. And then reducing toxins. I want you to breathe easier, knowing that your home no longer contains cancer-causing chemicals. Wouldn't that feel good? And then the 4th thing, and probably the most important thing, is to focus on you first. Because a non-negotiable, if you want to severely lessen the chance of getting sick again, and I promise it's possible, is to focus on you first. So let's learn a little bit about each of these. I just have a sip of water here. Okay, so let's talk about the right foods. Okay, there is so much confusion surrounding this subject. And there are, trust me, many, many, many different theories. And I've studied over 100 different ones of them. And I know the temptation is to throw caution to the wind and just say, you know what, I've had cancer. I'm going to eat what I want, drink what I want, do what I want. It's my life. I'm going to live it. I know it's tempting. And you're entitled to do whatever you would like to do. I'm not here to tell you one way or another, but I am here to give you the information so that you can at least make an educated choice, right? So if we're talking about inflammation, there are things that we want to eat more of, and there are things that we want to eat less of. More fruits, more veggies, more nuts and seeds, excluding peanuts and peanut butter, because they are actually inflammatory, primarily because of the mold that they have in them, because of how they are farmed, stored, and things like that. We want to eat more garlic, ginger, and turmeric. Add them to as many foods as possible. They're absolutely amazing anti-inflammatory things. Good fats like avocado oil, olive oil, coconut oil. The fats that we find, the omega-3 fatty acids that we find in salmon, sardines, herrings, things like that. And I believe 100% that not everybody has to be vegan or vegetarian, that we can eat clean animal protein within reason. I'm not saying every night. I want to see you mixing it up. But as long as it's organic, hormone, antibiotic-free poultry, chicken, ground turkey, or regular turkey. When it comes to red meats, we want grass-fed, pasture-raised beef, bison, or lamb. Okay, pork sparingly. We want to drink more water always. And herbal teas are fantastic. I'm a bit of a tea nut myself, whether it's the British. I grew up in the UK, so maybe it's part of the British personality trait in me. I'm not sure, but yeah, I'm a bit of a tea nut. So we want to be looking for organic teas and unbleached tea bags or loose leaf tea. These little things make a difference. So what do we want to eat less of? We want to eat less wheat. These are all inflammatory foods. Okay, these are foods that help to cause inflammation in our body. That's why we want to reduce them. So eating less wheat, dairy, and I talk about all of these and go into much more detail in my Thrivership School program. So wheat, dairy, and sugar. Yes, that friend, that one that we go for all the time. Peanuts, like I said before, because they contain carcinogenic toxins that are caused by mold. Processed foods. So think about anything that's in a bag, a jar, a can, a bottle. We want to eat less of them. And if we are eating them, then we need to know how to read labels really carefully. Again, something I talk about in Thrivership School. Fried foods, we want to be minimizing them, right? Because most often the oils that are being used are inflammatory oils, things like vegetable oil, canola oil, things like that. Those are inflammatory oils causing inflammation. We want to drink less soda. Diet soda, by the way, is even worse. And less alcohol, minimizing them. So I'd like to tell you about Jo. Jo's one of my clients. And when Jo and I first met, she had absolutely no idea how much the foods that she was choosing were affecting her recovery. She had no idea that her fatigue and her achiness were being added to by the foods that she'd eaten. And Jo, like I'm sure many of you listening, had tried every diet in the book. Not unusual. A lot of the women I work with have been on that diet roller coaster ride. But let me share something with you really quick about diets. They don't work. Okay, you are not failing. You're not doing anything wrong. Diets don't work. The statistic is a staggering 98% of women who have been on a diet gain the weight back and more within 2 years. Let me say that again. 98% of women who go on a diet lose weight, gain it back and more within 2 years. So I hope that if you've been on that diet roller coaster ride, you're just heaving a sigh of relief and saying, you know what, I'm done with diets. They do not work. My approach is much easier, much more compassionate, much kinder. And as Joe says here, I can't believe how easy Karen's approach is. I love the eat and do not eat list, and I don't feel like I'm depriving myself at all because I give you lists of anti-inflammatory foods and inflammatory foods, and you just get to choose your own foods based upon that. So now let's talk about pillar number 2 and managing our stress. So most often we don't even realize how toxic stress can be to our bodies. And I invite you to think about whether you went through a massive amount of stress prior to your diagnosis, as far back as 12 to 48 months prior to your diagnosis. Did you go through a massively stressful period? And I'm not just talking about a stressful day, but like almost like a really traumatic event or a period where things were just, you felt like you had a hard time keeping your head above water. I invite you to think about that. I did. A year before I was diagnosed, my mom passed away, and I was sat by her bedside as she did. She was actually diagnosed a week before she passed away with liver, lung, skull, and stomach cancer, 1 week before she passed away. Mom had dementia. She was living in an old, I don't want to say old people's home, or not an assisted living, but she was in a home environment. My brother, the day after my mom's funeral, needed life-saving surgery. And then my hubby was in a motorcycle accident, almost losing his right arm. We didn't know for a year. No, we didn't know, sorry, for 2 months, whether or not he was going to be able to keep his arm or not. All of that happened within a 1-month period, a year before my breast cancer diagnosis. So I'm going to bet that you've Googled if stress causes cancer. I did. For sure. And stress does not cause cancer, and that's what you will have seen. But how we choose to cope with that stress can cause cancer. Also, what happens to our hormones and our cortisol levels when we are stressed can often trigger hormone receptive cancer, which was mine. So how do we cope when we're stressed? We might drink a bit more than usual. We may be eating sugar, reaching for the cookies or the ice cream as it's going out of style. Or in my case, sour cream and onion potato chips, because that's my downfall. I'm human too, guys. But these coping mechanisms can all lead to inflammation. What does that do? It increases our risk of recurrence. So what can we do instead? I know you want to know, right? You're like, Karen, okay, what can we do? So how about a walk outside? Getting outside into nature can really have a calming influence. Try breathing slowly and taking in your surroundings. And we want to avoid sweating it out. I used to manage my stress that way. I used to be a personal trainer, an athlete. I used to do biathlons. I used to train Ironmen and was extremely, extremely active. And that was my way of coping, was sweating it out. And I thought it was a healthy way of coping until I learned that what I was actually doing was numbing myself to how I was feeling. I wasn't allowing myself the grace and space to feel my feelings, to validate that it's okay for me to feel that way, just as it is for you to feel however you're feeling, and to work my way through it. And so this gentler approach, this going for a walk, is so therapeutic. And then taking a warm bath. For decades, the benefits of a warm bath have been shared. And try adding magnesium boosting Epsom salts, one of my favorite things in the world to do, because they help to replenish our muscles and our joints. They help to detoxify that inflammation, pulling it out of you. And I think it's good for the soul. Whether you're reading a book or listening to music or whatever you're doing, don't reserve it for nighttime. Baths are good at any time of the day. So if you wake up and you're feeling anxious and you're having a bad morning, try it in the morning. Amazing. Another thing, like I said, I can't help. I'm a tea lover. So a cup of herbal tea. And this simple yet so effective stress management tool has been used for mindfulness for centuries. And you can see there holding that bowl for a cup of tea. And my favorite teacups are like little bowls. There's something to me very soothing about just holding that bowl, feeling the warmth, sipping the tea, being conscious, being mindful. Now you may be thinking, Karen, these are so simple. Do they really work? Yeah, they do. They do. I'd like to introduce you to Frances. And Frances, when we met, she said, my family were getting really fed up with me losing my shit. Excuse my language. She said, I felt horrible to even be around. I couldn't even stand myself. And then she started to use something that I teach in Thrivership School, your Craze to Calm plan. So easy. It only takes 10 minutes and it works. I love that smile. Just the best smile, right? Now let's go on to reducing toxins, a crucial but often overlooked part of boosting our recovery and reducing our risk of getting breast cancer again. And this crucial thing is to reduce the number of harmful, toxic, carcinogenic products that we bring into our homes. You may not realize that. Many of the things you're bringing into your home are known carcinogens. So where do we find them? Well, in the kitchen, in storage containers, food, and also in our cleaning supplies. In the bathroom, I find them in shampoo, conditioner, deodorant, toothpaste, cleaning supplies too. And in our makeup and skincare, face wash, moisturizer, treatment, serums, makeup, sunscreen. The list goes on and on. Deodorant, of course, too. And I teach where you find all of them and some really good, safer, cleaner options. And it can just feel so overwhelming, right? It seems like it's a lot. It's too much. So we can end up feeling paralyzed. We can end up feeling like we should be doing something, but we just don't even know where to start. And you need a plan. Just like you need a plan when you're dealing with those heaps of laundry. You're like, okay, well, I'm just going to start with this one over here, this pile. I'll start here. And we just start to work our way through it. It's very much the same. And one of the best resources you'll ever find when it comes to reducing toxins, as well as food and lots of other things, is EWG.org. Stands for the Environmental Working Group. Amazing, amazing resource. So I want you to meet Sarah. Sarah had no clue, like most people, honestly, about the impact of everything that she uses in her house and how it affected her risk of breast cancer. Now, she's chosen to follow my step-by-step guide to reducing toxins. And she's now feeling so relieved to know that what she needed to change and the things that need replacing, and that now she can buy them bit by bit. She doesn't have to go out and do it all at once, but she knows how to do it. She's got a plan of what needs to be changed, what better options to buy, and where to get them. It's that plan again, right? The way you heave the sigh of relief and say, okay, I don't have to figure it all out on my own. You don't. And now, as I said, probably the most important is prioritizing taking care of you first. No more putting yourself on the back burner to take care of everyone else. You've been there. You've done that. You bought the t-shirt. Guess what? It didn't turn out so well. You ended up with breast cancer. So this is how I like to describe it. We are the teapot. The people we take care of are the teacups. And we pour from our teapot our level of tea all day, every day into other people's cups. And what happens if we're not taking care of us first? That level of tea gets lower and lower and lower. And we end up drained, sucked dry, depleted, bitter, angry, resentful for being pulled in a million different directions, and upset with ourselves for not having the energy to do what we used to be able to do. I get it. And that's what happens when our teapot's empty. Now, what really shifted for me is that what many people don't understand is that there are personality traits of breast cancer patients that are common. There's actually 7 of them. But taking care of everyone before we take care of ourselves is one of those 7, just one, right? And I've made a promise to my kids, to my husband, that I would do everything I could to not get this disease again. And that meant that looking after me first became a non-negotiable for me. It was no longer an option. I want you to meet Karen. Another great smile, right? I love seeing these smiles after the women when we've been walking together for a while. I would love for you to be one of those women too. So what I didn't realize, Karen says, what I didn't realize before was that when I actually take the time to look after myself, I have more energy and I get less annoyed with everyone. I always thought that I'd feel bad or selfish, but Karen's shown me that it's the exact opposite. This has changed my life forever, forever. So the question is, would you like to be able to make these 4 shifts without stressing, without feeling overwhelmed, like you're trying to figure it all out on your own? I want you to remember that you're here because you want to enjoy every second of the precious life that you fought for. You don't want to be in fear every single day, constantly looking over your shoulder. You need a simple step-by-step plan to make the path clear, just like you did with treatment. Once that path is clear, you feel the relief. You feel like you're not on your own. And you want to feel what it's like to truly love yourself. Feel confident in your skin, no matter what. So there's 2 options for you to consider. One is you can continue to live in fear with all of your daily habits the same as they were before you were diagnosed. And you can be in this same spot next year. That's your choice. Or you can choose to make a long-term commitment to you, your health, and to taking the steps you need to regulate your side effects, help silence that nagging fear of recurrence while following a proven blueprint. I'd like to invite you to book a free 45-minute Get Your Life Back call with me, no obligation, but it's not for everyone, so listen up. First, I want to share about what you'll know by the end of our call. We use the call to find a crystal clear vision of where you want to go in your life. And the clearer that we get here, the easier it is to create a plan to get you there. We're going to look at where you are right now so that we know exactly where you're starting out. And we're going to uncover what's standing in your way of reaching your dreams. And if it's a good fit, and only if it's a good fit, we'll discuss how I may be able to help you implement your plan. Now, this call is for you if you're ready to invest in you and make the long-term commitment to your health and well-being. It's for you if you've always felt like you didn't fit in, like you've never really felt like you belonged, like you were maybe the black sheep of the family, or maybe you describe yourself as the square peg trying to fit into the round hole, then this call is for you. And if you want to make and fulfill the promise to yourself and your family that you'll do everything in your power to not get this disease again, then this call is for you. Now, it's not for you. And I remember I said it's not for everybody. And I'm going to be honest, always, and transparent. It's not for you if you're not ready to invest in yourself. It's not for you if you believe that you already know everything that you need to do to stay healthy, mind, body, and soul. And it's not for you if you're okay with barely existing, running on fumes, and living in constant fear. If you're okay with that, and that's okay, it's not my place to judge, but this call isn't for you. All you need to do is simply click the button below to schedule your call with me today. And I want to be honest and transparent. Only a limited number of these spots are available each month. It's a one-on-one call with me for 45 minutes for free. zero obligation. But let's get you clear on where you are, where you want to go, and if I'm the person to help you get there. Okay, it would be an honor to talk to you. You'll also receive an email with this link in too, but if you can, book your appointment today. Like I said, they're limited. Okay, thank you so much for listening. I hope that this presentation has helped you understand the stage that you're at now, to know that it's not done in a week or 10 days or a month. There's a period that it takes to go through this next stage of recovery. And it would be an honor to help share that journey with you. Okay, that's it for today, guys. Don't forget to book your call, and I will talk to you soon. Bye for now.